Okay, Mr. Chair, I believe we are live. You are set to start the meeting. Oh, just remind you to unmute. Oh,
All right, let's see, we've got the Board of Health, the Town of Northborough meeting for July 13th, 2021. I am Glenn French. We also have with us Teresa Capobianco. Present.
Yes, present.
Thank you. And Dilip Jain.
Present.
Very good. Not with us this evening is Dr. Swati Sane. Also, our health agent, Kristen Black, is here as well. And with that, I'll turn it over to Ms. Black to go through some housekeeping.
okay, thank you, Mr. Chair. Just want to read a brief statement about our use of remote meeting in this context. This open meeting of the Northborough Board of Health is being conducted remotely consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of the emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely, so long as reasonable public access is afforded so the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link and listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law, and this meeting will not feature public comment. So again, Mr. Chair, I believe you've already conducted a roll call vote, so I'll turn the meeting back to you. Thank you.
Okay, first on the meeting agenda, we've got the approval of the rather lengthy June 8th meeting minutes. And I'll take any comments or concerns or questions about those from the board.
Mr. Chair, I have a couple of probably grammatical / spelling issues on the meeting minutes. So on the 6-9 at the 609 thing, as of the last sentence in the first paragraph, as of June 1st, Northborough's vaccination rate was in the top 5% in the states. I don't know if we should say in the states or in Massachusetts.
Thank you. Yes.
You know, and with town / cities population over 10,000 or something like that out of towns, you know, it just didn't make sense there. And
Right.
the second thing in that one, also the DoubleTree Clinic, you probably want to capitalize double, capitalize tree, and add the word hotel clinic after that, because the DoubleTree Clinic sounds like a different type of clinic. And down below at the 642 meeting, third sentence from the bottom, the grant requires signatures from town administrator John Coder and chairman as opposed to
Yeah.
chairman. And that was all I found. Other than looking at this, Mr. Venencasa's name, I assume is spelled correctly. I don't know, but.
Okay. Very good. Teresa, anything from your end?
Hold on.
I
one
missed those, so.
Hold on. I don't remember seeing the June minutes. I'm actually just looking through my
Oh.
email to see if they were in there.
It was on the second email that she sent, not the last week's email.
I had to resend yesterday. I can
Yeah,
send it to
it
you
was
right
there.
now as well.
Yeah, well, all right, why don't we pass over the minutes for now?
Yeah, I can scan through them.
That's fine.
So
And I guess if we're all contingent upon Teresa's approval, then we'll pass the minutes in that fashion. How's that sound?
Okay, that's fine.
All right, let's go on to the next item, would be the COVID-19 update.
Sure, no pretty presentation or too detailed here today. So the good news is we have so few cases, I don't need to graph anything for you. I think we did have one new breakthrough case that came through on Thursday evening. So it was the only case we've had in at least 2.5 weeks. And it was for an individual in the 20 to 30 year category who was fully vaccinated with 2 doses of Moderna fairly recently, second dose in May, but we did have a positive case there. So, I think, I was just on the call with DPH today and, we expect breakthrough cases, right? Like the vaccine isn't 100%, so it doesn't mean that's not effective. The good news is that we're not seeing negative health outcomes, for individuals, even if it is a breakthrough case, is they have a much better health outcome. So, our workload on contact tracing is like zilch right now. I mean, all things relative. I think I had one call from a business with a positive case, but we're just, really excited to see that those the COVID-19 new cases is extremely low, and we're doing really well in Northborough, which is clearly attributed to our high vaccination rates. So no real updates there, no complaints on businesses. Things are moving along really well. And yeah, I can't remember, I should knock on wood, Katie, the last time we received a complaint on COVID and those sort of things. So numbers are great. Again, our vaccination site at the DoubleTree, I'm trying to remember our last meeting, we did officially close that site, and all the material was removed in supplies at the end of June. Our contract ended at the DoubleTree. And so the old food pantry in the bottom of Town Hall has now been converted into a PPE warehouse of lots of disinfectants, soaps, everything we would need. So really those pandemic supplies coming from the DoubleTree and other sources, everything from masks, some of the supplies were purchased for the regional clinic. Other items were distributed to the town through MEMA, the Massachusetts Emergency Management agency or other sources. So again, we're fully stocked up and everything is out of the clinics. And I have made some purchases over the last few weeks, which is gearing up for our children's clinics, most likely in the fall. We're going to be preparing and planning for those to be drive-through clinics for that 2 to 11 age group when it becomes available. We really don't have any more information than what you're hearing at the federal level, which is they anticipate that the studies are ongoing and they'll be filing sometime in late summer, hopefully for that next age category. And again, same thing, although you're hearing in the news about boosters, and I think it's Pfizer that's filed for approval for use of vaccines for boosters. There is no recommendation from CDC or Mass Department of Public Health on that topic yet. So it's something we're watching closely. But we are encouraging residents to continue to seek vaccination, and we're happy to help any residents who are struggling to book vaccine appointments. At this point, we have our great assistants have been helping to book people over the phone, even at some of the pharmacies and other locations in town. So that's really all I have, I think, on COVID right now, unless you have any questions for me.
I have no questions. Ms. Capabianco?
Thank you, Mr. Chair. Do we know if the individual with the breakthrough case was vaccinated? Because I'm starting to hear more about people who are getting sick with COVID-19 who have been vaccinated and they can't tell whether it's Delta variant or not. So anything about this?
Yeah, so the state is testing for different variants. It's sort of random. I'm not sure exactly how many samples they're doing. Every case that comes through that sample isn't analyzed, but they're doing a subset at the state level. The last I heard, Massachusetts, and this was several weeks ago, were about 6 to 10% of our cases are the Delta variant. And I'm sure that's higher that, in the last few weeks. This individual, I can definitely confirm this individual was vaccinated, but I don't have any information about the strain of the virus that individual had. So that testing is often done at the state level. I don't think they're testing every breakthrough case. They are doing like a subsample or a sample of those cases coming through. And that often is several weeks delayed from the case coming through. So they aren't alerting local boards of health as to, what variant might be associated with the cases in your town. They're really just reporting that at the state level. So I wouldn't necessarily know.
Okay, thanks.
You're welcome.
Dr. Jane, anything?
Nope, nothing. No questions. It's all good news so far.
All good so far.
Yeah, good news so far.
Did the person who had the breakthrough, what kind of symptoms are they? I mean, he must have felt sick to go get tested, or is he just one of these people who are testing randomly?
Yeah, I'm not sure in that particular case. I'd have to check the nurse's notes on that investigation. So yeah, I can't speak to that specific case.
All right. Just for the public's knowledge, what kind of symptoms are they seeing on these breakthrough cases, if we know?
It's really just the same COVID symptoms, it's, they could be more mild, but it really, that's why we remind everybody, everyone keeps saying the summer cold is going around, you really shouldn't discount any symptoms as to not being COVID. We want people to be vigilant and seek testing, and the free Stop the Spread sites are still open, although the hours are reduced. So again, the cases I've heard of, it's just I thought, it was a cold, or, it's just the testing. I haven't heard of too many cases coming out of random screening, because obviously the screening programs have sort of ramped down at most locations. So it's more that either people have to get a test for travel and they're showing up positive, or, hospital screening, for anyone, hospitals that are requiring screenings prior to procedures, you're seeing some cases come out of those. And then I think it's really just people following through on symptom testing.
Huh. Dr. Jane, what are you seeing? Anything?
So again, I think it's if we're seeing the variant, it seems to be occurring in younger individuals, 20, 30, 40-year-olds. There was one reported case of a person dying from the variant after having been fully vaccinated. So that's the first person who has passed away to COVID variant after having been fully vaccinated. She was a 60-some-year-old lady who had multiple medical issues on top of that. So unfortunately, if she had gotten regular COVID before the vaccination, she might have succumbed anyways. But, coming back to Kristen's point that, the vaccination is not 100% surety that you're going to be protected. So you still have to take precautions, especially if you have multiple other chronic medical conditions. Do what you need to do. And that's pretty much about it. But yeah, the symptoms are pretty much the same as it was with regular COVID or the flu. Nothing different from that standpoint, but I haven't heard anything else yet.
All right. All right. I think that's good. Anybody else? Anything else? No. All right. So we'll go, Kristen, if we could go to item number 3. If we're ready, the request for variance of 144, 150 West Main Street from section 2.13 of the board's rules and regulations for subsurface sewage disposal system. This matter is being continued from June 8th, 2021. Well, Kristen, I'll let you take it away.
Okay, great. So
Supposed to need paraphrasing.
at the last Board of Health meeting, you can remember that the board had requested some revisions. So you all should have received a cover letter as well as revised plans. I'm just going to quickly read over, the key points from the cover letter, and then I'll pull up the plan. And Teresa, please let me know as I zoom around if it doesn't track right this time.
Okay.
And then I'll hand it over to the engineer who is on right now and will be able to answer any questions. So again, revisions were provided to the Northborough Board of Health around June 16th. The plan for 150 West Main Street was revised to utilize Coltech chambers, which is a different technology for the soil absorption system. That allowed them to shorten the proposed trenches on that lot from 70 feet to 56 feet. And that system now, the soil absorption system, is 30 feet from the abutter, Pierce and 31 feet from the lot at 144. So I'll pull up those plans in a minute. I just also wanted to highlight from the cover letter, the plan for 144 West Main Street was revised to propose 4 shorter trenches in place of the 3 slightly longer ones. And that allowed them to move the soil absorption system on that lot to 20 feet from the lot at 150 and also stay outside the 100-foot buffer associated with the wetland setback. So they're much closer to meeting the town's local regulation with the 25-foot setback. So again, the applicant did note that they approached, or the engineer did note that they approached the Conservation Commission in regard to a waiver for the 100-foot setback on lot 144, and the commission's agent indicated that it was unlikely a waiver would be granted. So let me pull up that plan, and I will invite James Tatro to see if he wants to answer any questions. So let me just bear with me a minute as I rotate this, and I'll get ready for a screen share. Okay. So are you all able to see the plans here? So I'm going to start off zooming in a bit because I know this is a little tough to see. So the first sheet we're looking on here, this is the 144 West Main Street. And I'm gonna go, sorry, back to our list. Actually, Katie, I'm gonna make you a co-host as well. I sort of lose a view of my screen. So if you want to, I'm going to, yeah, so James, can you hear us here?
Yep, I can hear you.
Okay, and you're welcome to share your video if you'd like as well. So do you want to talk the board through some of these changes here?
Sure. I would be showing the same plans, but there's probably no point in my sharing a screen. As Kristen recounted, I guess I want to say, first of all, we asked, even though it's at the bottom of the letter, the first thing we did was we asked, I spoke to Mia McDonald, the Conservation Commission's agent, and explained the situation and asked if she thought there was any willingness on the part of the commission to consider a waiver from what is in their regulations, the standard saying that a septic system leaching area has to be outside of the 100-foot buffer zone, again, which is town reg, the state reg is just 50 feet. And what Mia said is that she, based on precedent and experience and the just general tenor of the commission, she thought it was extremely unlikely that waiver would be granted. What we did is taking the suggestion of Kristen, which I should have thought of before, but hadn't considered of looking at I guess we're looking at lot B, which is the more northerly lot, which is number 144. But what we looked at is what the available shape is within which trenches can be located. And we just figured out that we could, I know the discussion with the board at the last meeting in June was that what the board would be maybe amenable to considering a 20-foot setback if the full 25 could not be achieved. And what we found is we could get a 20-foot setback for the more northerly lot, as you see there, lot B, number 144, from the sideline between it and the more southerly lot, lot A. On the other lot A, the more southerly of the two, that's the one where we took Kristen's suggestion in looking at using Caltech chambers. Under Title V, you can build in a leaching area, a slightly smaller footprint if you use a Caltech chamber system, with the basic justification being that you get much more air to the system for having the chamber in that space over the area to which the effluent is applied. And so by using the Caltech chambers on the lot A system, as the letter says, we're able to reduce the length of each of the proposed trenches, and now we have 30 feet setback to the property line at the abutter Pierce to the south, on that system and 31 feet separation to the sideline between the two lots to the north of that system. So at this time, and again, I want to just to, in full disclosure, in the discussion at the June meeting, the board indicated that that the setback from a right-of-way line wasn't as significant a concern to it that with the putting words in your mouth, hopefully this is a correct representation, that the board was much more concerned with separation from sideline of lot to lot. And so these two systems would have the more northerly lot B, there's a reserve trench is the closest to the right-of-way line, would be 10 feet off the right-of-way line, which is the normal Title V distance. And on the more southerly lot, lot A, the nearest trench, reserve trench, would be 12 feet off the right-of-way line. I just wanted to be upfront about that, because we had essentially hadn't significantly changed those numbers from the previous iteration of the plans. What we did was, again, sort of two steps. First, tried to see if the Conservation Commission would be amenable to a waiver. And secondly, we did what we could to reconfigure both systems to try and get all that we could off of the sidelines. Again, meeting the 25-foot setback on sidelines of lot A, but not having it to the front. And on lot B, having a 20-foot setback to the sideline and a 10-foot setback of a reserve trench to the right of way. So we would be asking for a waiver of the 25-foot setback requirement under that section of the regulations from the right of way to 12 feet on lot A. And we would be asking for a waiver of that 25-foot setback on lot B to 20 feet from the sideline and 10 feet from the right-of-way line. So we have improved the situation, I think, in accordance with the gist of the discussion with the board at the June meeting, but we are still asking for waivers.
You came close.
Mm-hmm.
Yeah,
you fit it in as much as you can. You've got it in as much as you can. You can't move it back towards conservation. I'd rather see closer to the right of way than into the conservation land anyway. So really, as far as the setbacks to the right of way, on lot A, you've got 12 feet as opposed to 25 feet.
That is correct.
And Title V calls for 10 feet.
Correct.
So we're good on Title V. Anyway.
Yes.
So we're just looking for the bylaw. And then on lot B, you've got the 10 feet from the right of way.
Correct.
So we're good on that with Title V as well.
Yes,
So can we handle those variances? Or should we do it? I don't have any problems with this as far as it's being presented tonight. I don't know if anyone else on the board, Dr. Jane, do you have any?
I have no issues now as presented.
Okay, and Attorney Capabianco?
No, I think the changes satisfy the concerns that we had, and I'm not as concerned about the front line setback either.
Right, and as far as side lot setbacks, one is fine, lot A is fine, and lot B is 20 feet as opposed to 25. Am I correct on that?
Yes.
Okay. And there's nothing else, bless you, whoever that was. There's nothing else that we need to discuss. So lot B, you need a variance for the side setback from 25 feet to 20 feet.
Yes.
All right. So does anyone want to, I'll entertain a motion from one of the board members for that lot B side setback variance.
Kristen has something to say.
Yeah, just one
Okay.
point of order. I always get into trouble when it says lot B and A because you forget about that down the road. So if we could refer to maybe a motion
right.
on the
Lot B is
waiver.
lot B is 144.
Right. So what we'd be looking for, I guess we could do two motions. One would be a waiver from the 25-foot setback local requirement on lot 144 to 10 feet from the road and 20 feet from the property line with 150 West Main.
Correct.
Okay. Dr. Jane, would you entertain and affirm that, what Kristen just said?
Sure. So I propose the board approve variance for 144 West Main Street for the front front setback to 10 feet as opposed to the required 25 feet, and from the side lot with 150 to 20 feet from the 25 feet.
Excellent.
Second.
All those in favor?
Aye.
Aye.
Dr. Jane, aye.
Aye.
Attorney Capabianco,
Aye.
and Attorney French, aye. So that's good. As far as the second lot, 150, Kristen,
Yeah, so for 150, we'd be looking for the board to make a motion to approve a waiver or variance to the town's 25-foot setback to the right-of-way only. They're looking for a 12-foot setback.
Okay. Dr. Jane, I'll entertain a motion if you would.
Sure. I make a motion that approve the variance for 150 West Main Street for the offset to the front right of way from the to 12 feet from the required 25 feet.
Second.
All right. All those in favor, Dr. Jane,
Aye.
Attorney Capabianco,
Aye.
Attorney French, aye. Unanimous. Wonderful.
Great.
Could you just go over these Caltech chambers?
Sure. It's essentially, it's sort of a U-shaped cross-section chamber. And I think the general justification that Title V gives for allowing it a lesser footprint is that by having the chamber there above the base of the material, you're constantly getting more air into the system than a normal system, and you're getting a little better treatment. And therefore, the justification, I believe, is that the long-term acceptance rate can be better for this system than for a typical, perforated PVC pipe and stone trench or stone field system.
Are these chambers prefabricated, like your basic chamber?
Yep. And they come in, although you can get them. Actually, this was a big issue with me. I didn't quite understand. I thought you could only use them as, I think they come generally with a 7-foot length once one is overlaid over another. And there are slightly different ones. And I was trying to figure out how to get, these trenches to be, 28 feet or 35 feet or, some multiple of 7 feet. And finally, I looked deep in the back of the specifications for these chambers, and they say, well, it doesn't actually have to be a multiple of be it 7 feet or if there's some other ones that are 8, but a multiple of that standard thing that you can, in effect, saw a chamber in half and have, say 3 7-foot normal lengths and one of them that's sort of a half length and get to a length of overall length of trench that suits your particular context better than maybe, that multiple of 7, 28 or 35 or whatever. And that actually was actually pretty helpful on number 144, because I was kind of pulling my hair out trying to figure out, a way to get it to fit better.
Right. Interesting. All right. Anyone else have any questions about the chambers or anything else with regards to the 144 or 150?
No questions.
No.
All right. Excellent. Thank you very much, Mr. Tetro.
I want to thank you all for your consideration.
Very good.
Thank you. Good luck with the project.
Let's see, what else we have? Okay. Let's see, then, well, we're getting towards the end. The next item is the discussion of virtual versus in-person meetings. And Kristen, we'll hear from you on that, please.
Sure. So I just wanted to make the board aware that, at the moment, there's still the option to meet virtually or in person. Some boards are choosing, one or the other. There is a chance the Board of Selectmen at some point might come up with a policy for the town and various boards and committees to push them towards one direction or another. But that's, just something down the line that could happen. So there's still total flexibility for all of you and how you want to proceed forward. But for planning and blocking out Zoom rooms and all the rest, it's just we're sort of looking to get a straw poll of how you're all feeling. And if you want to keep with the Zoom meetings, maybe especially through the summer, as some people may be on vacation or out of town, we really have any format. I haven't had any comments from the public asking for one format or another. But I just want you to realize you still have that choice as we move forward, unless a policy were to come before us from the Board of Selectmen. But it's wide open, and I think it will stay that way for a while.
Kristen, question for you. So if the, I don't want to say if they're requiring, but if they're going to open it up so that you can have an in-person meeting, would it still be possible if somebody's away that they want to join, they could join via Zoom to have a combination, or no?
At this point, we just don't have the technology to do that. So I'm sure all of you have been on one of those hybrid experiences and you can't hear people and it doesn't, really work. So I know that is something the technology department or MIS GIS department is looking into, but we're not prepared for sort of the hybrid process at this time.
All right, thanks.
Okay. Well, I think we'll keep it as status quo unless anyone wants to come in. They could probably sit in that room with you. Right? Actually, I like the Zoom meeting myself. Is Attorney Capobianco?
I
What do you-
definitely prefer the Zoom meetings.
Right.
Because you never know where you're going to be.
No,
I think it
Takes that-
also, there's a lot of people who I think don't bother to show up for meetings because they have to travel to town hall, whether it's this board or any other board, but you're more
Right.
like, somebody's interested, they're more likely to attend a Zoom meeting. So,
I enjoy them a lot more than having to schlep in, even though it's not schlep, but even the extra effort. I like it this way. Dr. Jane,
Off the
your
record,
comfy chair?
off the record, unless we have wine and cheese there, it's good to have Zoom.
Very good.
Off the record.
Record. And from the administrative end, Kristen and Katie, what do you have to say?
I guess, yeah, I'm open to whatever. I think in some ways there might be easier access for the public to review the meetings and record them. The other thing that, my understanding is if we meet in person, there isn't the ability to, I don't think the meetings are necessarily recorded or streamed at this time.
Right.
So I feel like there's great transparency this way, but I'd encourage members of the public, if you're have a preference for in person or feel your needs aren't being met, you could definitely contact the Board of Health office and we can make that
Absolutely.
a consideration or bring it to the board's attention for the future.
Yeah, absolutely.
Katie has her hand up.
Absolutely.
Oh, no, I agree with Kristen. Yeah, I mean, I'm here anyway, so.
Trouble. Nothing but trouble. Okay, that's good. Is there anything else? Do we have to go over? Oh, I'm sorry. You know what I missed? Item number 4, the intermunicipal agreement for local public health services. Just that little thing.
Just that, I know I would have caught you. I wouldn't have let you in the meeting.
I'm
So
sorry
I'm gonna
about
go
that.
ahead and share my screen with this document. We've talked about this at prior meetings. The Board of Health has already voted the one-page letter of commitment, but this document here is a more formal document that will help to protect the town of Northborough as the host agency from sort of any liability, and just sort of the arrangement. It lays out the legal context of the arrangement of how the towns will work together. And again, this is all about providing shared services for the Mass Department of Public Health grant that was awarded to the town of Northborough for $300,000 a year for the next 3 years. Actually, this first year, the grant, fiscal year 22, it's $350,000 grant. So we've gone back and forth with the towns. Our legal counsel reviewed this and approved it in terms of form. This document was also reviewed. Our counsel is shared by Westboro, and also the town of Southborough's legal counsel, Jake Tallerman, with Tallerman Mead. They reviewed it as well, and those edits were all incorporated. So the working group that's participated on weekly calls about this document are all in agreement. And so it's really before you today for 2 reasons. I guess because you guys are appointed, not elected. Really, what we look for the board is we want all boards of health and boards of selectmen to sign on to the agreement. And really for the Board of Health would make the recommendation for the Board of Selectmen as the legal entity, you know, to enter into this intermunicipal agreement for shared public health services. So this draft was circulated by Katie. There's not too many major changes. We did create the form. It does have a separate signature page for each town, so we can really bring this together. So it would require, we're asking for a signature, the chair of the Board of Health and the chair of the Board of Selectmen or Select Board for the respective town. So really it's a legal document. So that's sort of part 1 is reviewing the document and voting it. And the other thing I would like for the Board of Health today is to actually appoint the member or the, let me get the exact words. So there is an advisory committee associated with this grant and the spending in this grant and providing the public health services and developing that programming. So we'd also be looking to appoint a member and an alternative as well. So I guess I'll start and hand it back to all of you to see if you have questions about this document or.
Can you go to the signature page again? I thought it duplicated the signature.
Let's see. So the signature for, there's a page for each town. So this, let's go to Northborough.
So it's duplicated the signatures again on both sides? Signature of Chair of Board of Health, signature Board of Health.
Oh, that's just printed name. Of
Oh,
chair.
okay.
Right. Yeah. It just can't always read those signatures down the road.
Okay.
Yeah.
All right.
And just to summarize the financial end, this is a 100% grant funded project, so the town wouldn't incur any. The town of Northborough does receive, you know, an administrative fee to administer this grant. So that's 15% of the total grant amount, and that would help to cover staff time. So this shouldn't be a drain on the community or the additional, you know, payroll or any expenses or council review is all covered under the 15% administrative fee.
So does that reduce the total grant by the 15%?
Correct.
So every year, technically, Northborough gets an extra 45,000 besides the sharing the other funds.
Yeah, the 15% is of the total grant amount. So on a typical year, if it's 300,000, $45,000 would go straight to the town.
Correct.
Yeah. And that would really go to the general fund. That would support, you know, the staff.
So it doesn't come to the Board of Health then?
Right, no.
You get credit for it.
And so just to give you also a timeline, so this, we do anticipate the town of Southborough, their Board of Selectmen is actually voting this tonight. Their Board of Health is voting it on the 14th. Our Board of Selectmen would be meeting next week. Boylston's Board of Selectmen is has this on the agenda for the 19th. Their Board of Health will vote it as well no later in Boylston than July 26th. Westboro, both Board of Selectmen and Board of Health will be reviewing this same document and voting on July 20th. So We are hopeful and optimistic that this is something that could be in place, which would then let our shared health inspector role, begin right away. And just an update that we had put out a request for proposals for shared public health services. So that's the largest part of this grant, is each year $131,000 is set aside for shared public health services. And that is going out to bid, and that will be contracted. And those proposals or responses to the request for proposals is due on July 15th. So we're hoping to move this all along quickly. And this IMA is the instrument that would really allow it to all come together legally.
Have we received any interest from any public health nurses?
Our public health nursing is provided by Sam and VNA. They're very interested. I've had several conversations and meetings with them about, their interest in their proposal. And the only other inquiries, I've received many email inquiries from staffing agencies that are just, just provide medical staffing. They really haven't come at it with any, per se experience. We're looking for nurses to come in who are in, the states, MAVEN, MIIS, they're ready to go to do disease investigations and surveillance, as well as really where we're getting expanded public health nursing is it's really getting into the educational elements to have weekly hours at our senior center staffed by skilled nurses, that can really support our residents as well.
Okay. Well, I have no questions on the agreement itself. Dr. Jane, any questions on the agreement itself?
No questions.
Attorney Capabianco, any questions on the agreement itself?
Yeah, the only question I have, which I guess is maybe directed for Kristen, is these are quarterly meetings, and the individual appointed and the alternate must both attend these quarterly meetings?
The alternate wouldn't have to attend, but would be encouraged to. So each town has one vote. And there'll be public meetings. So you notice that open meeting law is also like inserted through this. So anyone would be encouraged. We really would like, an active alternate, because a lot of this is programming and really direction for the town, but it wouldn't be required. The quorum would be based on the voting members in order to hold the meeting.
Okay. And do we know, are they thinking a specific time of day for these meetings, or is that too far in the future?
No, I think we have flexibility. And I think it will really depend on who's appointed to these roles, and we'll probably do some polling to determine the best day or time of day. So I think there's flexibility on that.
All right. That's it. That's all I got.
All right. So we should move to accept this agreement as it's presented to the board and send it to the selectmen. Is that correct?
Yes, I believe so. I think we'd be looking for a recommendation from the Board of Health for the town to enter into this agreement, this intermunicipal agreement for local public health services.
And we have a motion on that. All right. So we need to recommend that the town of Northborough adopt this intermunicipal agreement. How's that sound?
So moved.
I can't make the motion, I don't think. Dr. Jane?
I recommend that the town of Northborough adopt the intermunicipal agreement for local public health services as written.
Second.
All those in favor? Dr. Jane?
Aye.
Attorney Capabianco?
Aye.
Attorney French? Aye. Good, unanimous. Then now we have to go to the second
Yes.
act of a two-part play. And that
Yeah,
is
so I just
to-
want to read that section, if you don't mind, Mr. Chair, just so people know what they're getting into. Hold on, I have this section here in my email.
Section
It's
3?
Right here, roles and responsibilities. So specifically, the next part of the discussion is about this advisory board. So sorry, that's what it's called, not a committee, advisory board. So the advisory board is going to convene quarterly or more often as needed. We're hoping to not have this be a large burden because it is an open meeting and minutes and all the rest. And so this board is one vote for each of the participating towns. And so we're just looking here. So for each town, there's one full voting member of the board whose term shall be determined by the town's local board of health. This member should be either a board of health member or a health department staff person. And there should also be an alternate who may participate in board meetings, but may vote only when the full member is not in attendance. And so I guess we'd be really looking probably for a vote as well as maybe a term associated with the appointments. And just for everyone to understand the role, this advisory board is meeting on a regular or quarterly basis. They're going to develop the annual and long-term goals for the, and the name of the partnership is officially the Greater Boroughs Partnership for Health. They'll also advise the Greater Boroughship Partnership for Health staff on priorities. They'll collaborate in a sustainability plan, so how the towns will maintain this over time. They're going to adopt any policies or recommendations on regulations. They will review and approve recommendations on operating budgets. They'll review the financial status, review and approve recommendations on reports from staff. So there will be monthly reports from staff submitted. And right now, what will be coming up after July 15th deadline is they'll draft and approve the nursing scope of services.
Okay. And so is the town, is this group looking for like actual member from the Board of Health as far as our representative? Or is it something that we can just send Katie?
Yeah. Or, well, I'm living it every day, so I wouldn't mind serving on the board.
Yeah.
And then, but I think it would be good to have a backup and the Board of Health involvement. I mean, if any of you are really
Right.
excited, but if you're concerned you might not be there all the time, or you don't have that time to dedicate, an alternate may be a good approach. I'd probably leave Katie out of unless she wants to. She doesn't know yet. She might be helping a little with the minutes. We'll have to. We haven't worked all that out, and we're trying not to drain staff.
No? Okay. So-
Unless you want to speak up, Katie, do you want to nominate yourself for any of this?
I'm gonna pass.
You're gonna be there anyway, you said.
In this building on Tuesdays. No, I mean, if I'm happy to take minutes and stuff. I mean,
But the meetings are gonna,
figure that out.
these meetings are gonna be held in Northborough anyway, correct?
Yeah, well, it's gonna involve representative from each of the towns, so,
Right.
you know, I think while we can, we'll stay on Zoom and make it
Zoom.
easy, and then if that's removed as an option, we'd probably, rotate towns. Probably be on a rotating schedule for those meetings. So there could be some travel down the road if Zoom is not an option.
Right.
But again,
And-
it's quarterly, so only 4 times a year, so
Right.
it hopefully won't be too bad.
So we're looking at a 3-year stint. And it doesn't have to be 3 years for the backup. Or the primary, really, but it probably should. But 3 years is a long time out, so maybe we could revisit it after each year.
Mhm.
I think that's probably the best idea.
Yep.
Life is changing, we never know.
Right.
As far as the backup goes, I wouldn't be opposed to being backup,
I wouldn't oppose to being a backup either.
so there we go. Attorney Capobianco,
I actually would probably defer being a backup until
Okay.
the second, until year 2.
all right.
Yep.
So we have, well, Dr. Jan, you probably understand this, these things greater than I would. If you want to be the backup on this,
Sure, I have no problems. I can try.
I think it's probably best.
Yeah, I would suspect that this is going to be in the evening, kind of like our monthly Board of Health meeting. So I can't imagine it being the middle of a work day.
No,
then would make it convenient, then that's fine.
I don't know. Kristen, do we have any idea when these meetings are gonna be?
No, I mean, I think that quarterly, it's not such a demand. We'll do
No.
what works for the group, you know? So I think we really
Yeah.
want the alternate members to be able to participate, especially in the discussion as we're developing programming.
Right,
And really trying to, especially, develop this program in its infancy.
Mhm.
So we'll do what works for the group.
all right. So I think we've already sent it. We've already made the recommendation. Do we have to vote on Dr. Black taking the lead voting?
Yep. I would
Okay.
recommend the board would officially, there'd be a motion to appoint Kristen Black as the voting member to the advisory board and to appoint Dr. Jane as the alternate voting member for the Northborough Board of Health for this role. And I think, as you guys had mentioned, it would be for a one-year term.
Okay. Attorney Capabianco, did you get that?
Did?
Could you make that motion, please?
I can.
All right,
I would move that the Board of Health appoint Kristen Black to serve as the primary member of the Northborough, for the advisory board on behalf of the town of Northborough for the Greater Boroughs Partnership for Health, and that Dr. Jane serve as the alternate member for that advisory board as well, each for a one-year term.
excellent. I'm going to second that motion. And, okay, all those in favor?
Aye.
Dr. Jane,
Aye.
Attorney French, aye, and Attorney Capabianco.
Aye.
Excellent. Oh, we're moving.
We
We're
can do
moving.
the minutes, Mr. Chair, if we're done with this.
Okay. Okay, well, I have no further changes or additions to the July 13th or amendments to the July 6th.
June 8th.
I'm sorry, June 8th meeting minutes. Dr. James made his recommendations and Attorney Capabianco.
I have no further edits. Thank you.
Okay, then I move that we accept the minutes, approve the minutes from June 8th, 2021 with the changes proposed. And that would be it.
Second.
So all those in favor, Dr. Jane,
Aye.
Attorney Capabianco,
Aye.
Attorney French, aye. That's done. And that's it, I think. We got to establish a tentative future meeting date.
August 11th, is it?
I got August 10th on the list,
10th, August 10th. Yep.
August 10th. Good. Anything further?
No.
No? Kristen?
No.
Good.
I will forward, if you'd like, I can forward as we receive proposals for the shared nursing services agreement. I'm happy to forward those along to the board as we proceed through that. So feel free to reach out if you have any questions or comments.
And do you need me to stop in and sign this agreement? I will do that
That'd be great. Thank you.
tomorrow. 7:30. Good. Well, I move that we call this meeting to a close.
Second.
All those in favor?
Aye.
Very good. All right then. Thanks, everybody.
Thank you. Have a good day, everybody.
Thanks,
Yeah,
everyone.
Perfect.
Enjoy
Stay
summer.
well.
Good
Bye.
to see you all.
Have a good night.
Good
Keep
night.
it going. Thank you.
Bye.
Bye now.